Yes, there absolutely is. This is something that is near and dear to my heart for a long time. Looking at what happened during the SARS outbreak and other things. So an ethical framework about how we approach these questions, these incredibly important questions, is something that we developed in H1N1. We've refined it during the Ebola crisis in 2014, and we've used that background with a very strong group of clinical ethicists, or not clinical ethicists in our province that we've had ongoing discussions with over many years, and I raise my hands to them. We have a really strong group of ethicists in this province who have assisted us on this, and since January, when this first started, I tasked them with looking at developing the framework that we can use and adapting the framework for COVID-19, and then addressing some very specific questions. One of those is around personal protective equipment, and the other one was around ventilator and decision making about who will get scarce treatments if that comes to pass. So we do have a very detailed framework, and I thank all of my clinical care, my nursing colleagues who were involved in developing this framework. It does have a whole protocol for how we will manage this, so that any single individual physician or clinician will have to make that decision on their own. There is a system that is being set up for clinical decision-making, ethical decision-making at each hospital that's involved, and also a provincial strategy, we call it a tripartite appraisal, I'm sorry, I can't, TATT, but I can't remember what it stands for. But we have people at the provincial level that include myself and a critical care lead, a nursing lead, who will be imposing, if we need to, the framework, and it will be under the specific circumstances, and it is all laid out, the considerations that we have, the ethical principles that underlie the decisions that will be made. So it is, and I want to reassure my colleagues, because this is something we worry a lot about in healthcare, is having to make that decision on our own.